Hey guys, and welcome to another video of For Fact's Sake with me, Dr. Rohanti. So it's been about 3 weeks since I made my first video on the coronavirus, and since then things have been crazy. So over the last few weeks, we've gotten a new name for the infection, the number of people infected has gone up, there's been a lot of exaggerated news, and the Australians are stocking up on toilet paper. Wait, what? Anyway, the situation's been getting intense, and this is the time for us to embrace our facts. So in this video, I'm going to be debunking 5 common myths about COVID-19, including whether you should be wearing a face mask and whether you should be canceling those travel plans. So keep watching. All right, before we get started, let's take a time check. As I'm filming this video, it is the 7th of March, 2020 in Australia, and as of last night, we've just crossed 100,000 infected cases, with just a little over 3,000 deaths and 56,000 people having recovered from the infection. So in the second week of February, the WHO actually renamed the infection as COVID-19, where CO stands for corona, VI stands for virus, and D stands for disease. So COVID-19 isn't the name of the virus, it's actually the name of the illness that the virus causes. They actually decided to call the virus SARS-CoV-2. So think of it like how AIDS is an illness or a syndrome caused by HIV, the virus. So similarly, COVID-19 is the illness caused by SARS-CoV-2. All right, now that that's out of the way, it's time to bust some myths. Hiya! Myth 1, if you don't have the symptoms, you don't have the virus. So I actually covered a little bit about this in my last video, but the short answer is you can still have the infection even if you don't have the symptoms. COVID-19 presents in many different ways. Some people might have mild flu-like symptoms, others might have shortness of breath and need hospital admission, and others may have no symptoms at all. So why do you need to know that? Because it also relates to the spread. So right now in China, for example, they're doing this vigorous temperature testing where anyone with even the slightest rise in temperature is being isolated with an assumption that they have the infection. And that's not a bad idea, but you're not going to catch every last infected person. So there are people out there who are infected, who don't have a fever and don't have any other symptoms, but they can still spread the infection through a cough or a sneeze. So with COVID-19, you can spread the infection before, during, and after you've had the symptoms. So you need to follow your protective precautions with everybody, regardless of their symptoms. Myth 2, you can get the virus from packages shipped from China. No. Coronaviruses can't survive for very long on inanimate objects like packages or letters. You could get the virus from the guy delivering the package to your door, but if you think the virus is going to be traveling all the way from China on the package, alive and ready to infect you, you would be mistaken. Myth 3, wearing a face mask will protect me from COVID-19. Okay, so this one needs some serious explanation. And there's been a lot of confusing messages about face masks, even from reputable health sources. So on the one hand, you've got governments of countries handing out face masks by the millions. And on the other hand, you have these disruptive news articles talking about how clinicians and epidemiologists are saying medical masks are useless in infections and they're not going to protect you from COVID-19. So which one's true? So first of all, you need to know that there are 2 types of face masks. The first one is a medical mask, which is essentially a piece of rectangular fabric with either ear loops or strings to tie the mask around your face. This is the one that governments have been handing out and you see everybody wearing them. So the second is a respirator, which is a special mask that fits tightly around your nose and mouth. And it's made out of this fabric with a smaller pore size so that it can filter out airborne particles. So respirators are only worn by healthcare workers, and they actually have to undergo this thing called a fit testing to ensure like a good seal between the mask and your face so that no droplets can enter through the gaps on the sides. Okay, so you've probably figured out already that a medical mask does have gaps on the sides, so a respirator is logically better. So why aren't we handing those out? Okay, first of all, the 2019 coronavirus appears to be spread by droplets, and we don't have enough evidence to say that it is airborne. So you contract the infection by coming into contact with the infected droplets that come from someone's cough or sneeze. So when they're handing out these medical masks, they're hoping that For an infected person, the mask will contain the droplets when a person coughs or sneezes. And for others who aren't infected, it will form a temporary barrier against direct splashes of a person's cough or sneeze. Or if you touch an infected surface, it will stop you from directly touching your face after that. So that's how they're hoping that the masks will help. And there are actually studies out there that compare these medical masks to respirators. And they've shown that medical masks can actually be just as good as respirators in preventing droplet spread infections. So you don't actually need a respirator. So why are doctors discouraging the use of medical masks for COVID-19? Because they're not being used right. So most of these studies that test medical masks against respirators and infections are done in healthcare workers who are already following other contact precautions like washing their hands and wearing a gown over their clothes to protect them. But most importantly, they wear a new mask every time they go into a patient's room and they throw it out as soon as they get out. So at a time, they're only wearing the mask for about, say, 10 minutes. So what happens when someone buys their own masks or gets given one? They wear the same one all the time. So think about it, you're wearing the mask all day, you're breathing into the mask, it's making it moist, that's reducing its efficacy, you're putting it down, leaving it around on the table, you touch the inner surface, then you put it back on, it's losing its entire purpose. So short answer is yes, medical masks do help, but only when they're used right and only when they're coupled with other contact precautions like hand washing. I need a breather after that one. Myth number 4. I cannot travel on planes because if an infected person is on the plane, I will definitely get COVID-19. Again, a lot of misconception about this and no clear answers. So the first most important thing is that we know that the SARS-CoV-2 virus is transmitted by droplets and is not airborne. And I know a lot of people are questioning this right now, but hear me out. There was actually an article published on the 4th of March 2020 in the Journal of the American Medical Association, which is a highly reputed journal. So in this paper, they actually assessed the contamination of 3 patients who were admitted in hospital with COVID-19. So what they did was they took swabs of different surfaces in the patient's rooms, which included like their tables, their toilet seats, their air outlets, and most importantly, they sampled the air. So most of the surface swabs came back positive for the virus, but all of the air samples from all the 3 patients came out negative for the virus. And I know this is a small sample size, but it's still early days and this is the information we have so far. But we can couple this information with the fact that we have had cases of infected people traveling on planes and then coming back and testing positive for the virus. And in this case, we didn't have the entire plane of people being infected afterwards, even when they were followed on and tested. And in cases where people did get infected, it was usually because they were sitting 2 rows in front or behind the original infected person, and they probably had contact with the infected droplets. So long story short, you're not gonna get the infection just by traveling on a plane with a potentially infected person. You will get the infection if you don't follow the right contact precautions when you're sitting next to them. Myth 5. There's been too many infected cases and deaths. It is now time to panic. Okay, it is never the time to panic. Yes, it's a pandemic, but it's not nearly as bad as some of the other infections we've had in the past. And I have seen heaps of videos online trying to calm people down with the numbers, putting things into perspective, but I'm not gonna do any of that today. My strategy is this: panic gets you nowhere. Imagine if you're having a heart attack and your doctor panics. Would you survive? Well, not unless they do what it takes to save you. Panic is not a protective measure, but minimizing your handshakes, washing your hands, and covering your mouth when you cough and sneeze, these are certainly infection preventing measures. You know, if there's anything that's good that's come out of all of this media sensation, is that people are discovering that hand washing is a real thing. Yeah, shocking. Anyway, don't panic and definitely don't be one of these guys. For fuck's sake. If you like this video, give it a thumbs up and subscribe to my channel. And more importantly, leave me a comment. I'd love to hear your thoughts, your questions, and your ideas for my next video. I'll see you at the next one.